Hi, everyone. Welcome. My name is Brad Siff. I'm the founder and president of BioWave. And this webinar is going to be on the topic of pain treatment applications using our foot ankle BioWraps. At the end of the session, we will have a live Q&A session. Please look for the Q&A tab in the middle bottom of your screen and submit your questions that way. We hope you enjoy this webinar. So this presentation is going to cover our foot ankle BioWrap, which is a wearable compression electrode garment. The biggest clinical advantages of using this technology is that it can provide over 6 times the treatment area. We treat over 6 times the volume of tissue as compared to a conventional 2-inch diameter round electrode. We use this advanced silver fabric electrode technology. It's a circumferential electrode, so we treat completely around just proximal to the ankle, and we treat completely around the entire metatarsal region of the foot. The device is providing compression simultaneously while allowing the delivery of our high frequency neurostimulation technology into deep tissue. There's no guesswork as to where the electrodes are placed because they're fixed within the device. This is a reusable device. It's guaranteed for 1 year and it's easily cleaned. This device can be used with our BioWave Pro neurostimulator, which is typically used in clinics, hospitals, and athletic training rooms. And it can also be used with our BioWave Home prescription neurostimulator. The BioWrap comes in 2 different sizes, a small, medium, and a large, extra large. In the small, medium can fit women's feet from size 6 to size 10, men's feet from size 5 to size 9. The LXL size fits women from size 11 to 16 and fits men from size 10 to 15. This design can be used on either the right foot and ankle or the left foot and ankle. The construction of this device, on the left we have an inside view and on the right we have an outside view. On the inside, you can see we have a circumferential electrode that encompasses the entire region just proximal to where the ankle is located, so we can treat completely around that region of the lower limb, the lower leg, and then the lower circumferential electrode encompasses the tarsal and the metatarsal region of the foot. The heel sits back in this region here where there's a hole, and the foot comes across the bottom electrode where the icon indicates. On the outside, these are the compression straps, and there's 2 Velcro attachments, 1 for each strap, and we have 2 4-inch snap cables. These cables provide the electrical connection from the silver fabric electrodes to our lead wire cable that goes with either our BioWave Home or BioWave Pro device. Because of the design and construction of this electrode compression garment, it allows us to target most of the nerves running through the ankle and into the foot. And this includes the tibial nerve, the medial and lateral plantar nerves, the deep and superficial peroneal nerves, the intermediate dorsal cutaneous nerve, and also the saphenous nerve. So it really does not matter what's causing the pain condition to occur. What's important is that the electrical field forms deep enough along that entire circumference of where the 2 electrodes are. And if that electrical field that we create, the active field that we create in deep tissue in the body, can encompass those nerves that are conducting the pain signals to the brain, then there's a high probability that this technology can help reduce pain for that patient. So there are many different potential pain conditions that can be treated using this device. And you should think of this device as a first course therapy for treating both nociceptive pain conditions as well as neuropathic pain conditions. So one of the biggest applications where we've seen excellent success with patients is treating painful diabetic neuropathy. And so where a patient has a dull thudding or burning pain throughout the ankle area and the entire foot, when you attach our high frequency stimulation to this device, the patient feels like the entire region from just proximal to the ankle down to the toes is being stimulated. It feels like the entire foot and ankle are being stimulated. And so it's a very useful treatment for patients that are suffering from PDN. We've also had success treating patients who have pain that results from Morton's neuroma, from plantar fasciitis. The circumferential electrode around the foot is right over the location of the plantar fascia, often where the pain presents. This device is really ideal for pain that results from ankle and foot sprains, whether it's a low sprain or a high sprain, as well as from tendinopathies. For example, from Achilles tendonitis, we're capturing the proximal end of the Achilles tendon. And so if that's where the pain's presenting, we can get good treatment along the Achilles tendon there. For metatarsal pain or pain over the tarsal area, or over where the cuneiform and cuboid bones are located, if there's pain in that region, that lower electrode, circumferential electrode, is really encompassing that entire region. And so similarly, you're able to get pain relief from a transverse tarsal or tarso-metatarsal joint pain condition. So we're really capturing such a large volume of tissue throughout, as I said, just proximal to the ankle and through the entire foot, that this is a very useful tool as a first course therapy for helping your patients. So let's talk about some of the pro tips for applying this device. And it's important to take you through this to make sure that your patient is going to get optimal results from using it. So first and foremost, in order to allow our devices to deliver the high frequency neurostimulation through these much larger electrode areas, we have to place a conductive cream and just a pea-size amount, one pea-size amount for each of the electrodes has to be rubbed into the skin. So you have to rub in completely around the entire region, just proximal to the ankle, and completely around the tarsal and metatarsal area of the foot. It's okay if the cream spreads beyond the region where the silver fabric touches, as long as we're getting the entire top, around, bottom of the foot, and all the way around just above the ankle area. So you want to rub it in. You don't want a huge amount of white cream, staying at the surface. So that's very important because that's going to enable this device to work properly. Both 4-inch snap cables that I pointed out before will already be snapped into the snaps, one up on the upper electrode, one on the lower electrode. So just confirm that they're already there and attached. Then you can attach your BioWave lead wire cables from your BioWave home device or BioWave Pro device to the two blue prong connectors. You want to place your heel back into the hole and step across the bottom electrode as shown in this second diagram. In the third diagram, now we're going to start with the top electrode. We're going to take that compression strap, pull it through the D-ring, and pull it so you've got tight but comfortable compression on the upper circumferential electrode. Then you're going to pull it tight and back around the front of the ankle and then across the back again, just proximal to the ankle, and secure it with Velcro somewhere on the back side. Now we're going to repeat that process for the lower strap. And you're going to pull it through the D-ring, pull it tight. It's very important to make sure that there's no gaps that are occurring anywhere along the perimeter of that electrode. That goes for the upper electrode as well. Then you're going to pull that compression strap back across the front of the foot and secure it tight with the Velcro strap. So when you're all done, again, check to make sure there are no gaps. Anywhere, it tends to occur more on the edges of the foot and sometimes the edges just proximal to the ankle. We want to make sure there's good conduction between the silver fabric and the skin throughout the entire circumference of the foot, or the circumference just proximal to the ankle. So couple troubleshooting tips. So if there's a connection error, your device will show, as in this image here, two pads with an arrow to the body. The pads to the body error icon basically is telling you, hey, the device doesn't see the pads on the body, even though you're all hooked up. The device is hooked up to the cable to the BioWrap to the foot. So if you see this error condition, it means one of two things. Either the skin impedance is too high or the skin impedance is too low. So if the skin impedance is too high, it may be because the foot is very calloused on the bottom, and perhaps maybe you forgot to apply conductive cream to the skin, or you didn't apply enough conductive cream because the skin is so calloused. And so the device just can't see the attachment, the conduction between the silver fabric and the skin, because the resistance or the impedance is too high. So in that case, you need to remove the BioWrap, clean the skin thoroughly with soap and water. If there's hair, more likely around the area of the ankle or just above the ankle, you should shave that location, and then apply the BioWave conductive cream all the way around both locations, and then reattach the BioWrap and restart the treatment. And that will correct this error condition that you see. On the other hand, if you applied too much conductive cream and there was a lot of white cream still on the surface of the skin, and then you put the BioWraps on, it may be that the skin impedance is too low and the device isn't going to see the electrodes because the impedance is so low. So in that case, remove the BioWrap, take a dry towel, clean the excess cream off of the skin, and clean any excess cream off of the silver fabric on the BioWrap. Then reattach the BioWrap and then restart the treatment. So there's one other, this is less of a troubleshooting and more of kind of a pro tip. And let's say that you're all connected and it's working, but the sensation that the sensation that the patient feels is stronger under one electrode versus the other. So you have two variables here for controlling the sensation on either of those two electrodes relative to one another. So the two variables are compression and the amount of conductive cream you use. So the tighter the compression and/or the more conductive cream that you use, the stronger the treatment sensation. The less compression, the looser the BioWrap, and/or less conductive cream will mean less of a sensation. So let's say it feels much stronger around just proximal to the ankle versus how it feels around the foot. In that case, you could loosen the compression on the ankle to make it feel less strong. This is if you want it to feel stronger on the foot relative to the ankle. You could also remove the BioWrap, add more cream around the foot, then put the BioWrap back on see how it feels. If the ankle still feels stronger, just make the compression tighter on the foot and less tight on the ankle. So those are the two variables you have to adjust the sensation in both those locations to either make one stronger versus the other, or to make them feel the same, depending upon whether you're trying to treat the entire foot and ankle, or you want to be more focused on the foot, or more focused on the ankle. And this is the conductive cream, this image here that comes with your BioWrap. The treatment protocol, it's a 30-minute duration treatment, as are all BioWave devices. And we recommend, typically with this device, 2 to 3 treatments per day, separated by at least 30 minutes in between treatments. So you want to let the body come back to a normal state before you hit it again with another treatment. It doesn't have to be exactly 30 minutes. If a patient wants to treat one time in the morning, one time midday, and treat at night before they go to sleep because it'll help them sleep better, it's whatever the patient needs. So basically, the patient should treat themselves on an as-needed basis. There's no limit to the number of treatments you can do per day. There's no harm in doing more treatments. If a patient's having a bad pain episode day, they can do 5 or 6 treatments, whatever's required to be able to manage their pain. But in a normal treatment course, usually patients will use it 2 to 3 times a day. Both doctors and patients report that there's a cumulative benefit with multiple treatments. So when you first start out, we'd recommend doing, say, 3 treatments, each one separated by 30 minutes. So you're kind of hitting that region hard, and that will really begin the effectiveness and the pain relief. And then, you could do that daily, or, and after several days, you can move, instead of from 3 treatments to 2 treatments, or from 2 treatments to 1 treatment. Again, but you use it as needed, as I described. The contraindications for this device are: you cannot use it if you have an implanted cardiac pacemaker. There's no negative data, and even though the treatment is located very far away from where the pacemaker is located, the FDA requires us to contraindicate it for those types of patients. The silver fabric electrodes must be placed over intact skin. So you cannot use this electrode compression garment if the silver fabric is going to be over open wounds, broken skin, very rashy skin, or sensitive skin areas like sunburned skin. Please note, though, that BioWraps can be used directly over or in the proximity of any type of implanted or orthopedic hardware, metal hardware. So that includes total joint replacement, anchors, plates, rods, screws, pins, or clips. As long as those devices are not piercing the surface of the skin, if they're implanted, you can use this device on your foot and ankle over those types of implanted metal hardware devices. In terms of cleaning, you can clean the silver fabric on these electrodes using a Purell brand hand sanitizing wipe. So any type of sanitizing wipe that can be used on the skin can be used on the silver fabric. The best way to wash these is to hand wash them using mild soap. Please disconnect the 2 4-inch snap cables from their snaps and before you hand wash the BioWrap. You can fill up a sink and put in a little mild soap. You can rub the soapy water on the silver fabric, on the neoprene sections of the BioWrap, rinse it under the water, and then place it on a flat towel to air dry. That's the best way to clean it. You do not have to clean it after each use, maybe once a week, once every 2 weeks at most, depends on usage and how clean your skin is. So do not wash this in a washing machine. Please do not place it in a dryer, and do not dry clean it. Dry cleaning it will destroy the BioWrap. The others will significantly limit the life of the BioWrap.
Well, thank you so much for joining our webinar today about the foot and ankle wrap. We really appreciate everybody joining, and hopefully you found it really helpful. At this point, we'd like to open it up to questions and answers. So it looks like the first question we have, what considerations should be made for patients with a lack of sensitivity due to neuropathy? Can they still use the foot and ankle BioWrap? So that's a great question. We see many patients that have reduced sensitivity in the area of treatment, particularly due to PDN. It's a very common thing. So they absolutely can still safely and effectively use the foot and ankle BioWrap. We've treated many patients like that before, and they have still benefited from pain relief and use of the device, both electrodes and the foot ankle wrap. My recommendation would be as follows. If you use this wrap on a patient and you see that they very, very quickly go up past 50%, it's typically an indication of either a reduced sensitivity in the area or we haven't cleaned the skin well. Okay, so with somebody with, say, severe numbness in the area or lack of sensitivity, my recommendation would be to first clean the skin really well, as Brad mentioned. Right, and sorry, clean the skin really well, soap and water, rub it well, make sure you pat it dry fully. Okay, you're going to use a pea-sized amount of cream on each area of the foot on the or the ankle and where the silver fabric electrode is going to touch. Okay, so you can do those two things first. Okay, then restart your treatment. Okay, if the patient still really wants to go well above 50%, my recommendation would be to stay below 50% initially for the first 5 to 7 minutes. There is no danger in going up higher, but we have a lot of data that suggests that even with a lack of sensitivity, they still are benefiting from the treatment. So for the first 5 to 7 minutes, let their body accommodate to the treatment a little bit, stay below that 50% threshold, and then ramp slowly throughout the remainder of the treatment once you pass that 5 to 7 minute threshold. Again, they might have reduced sensitivity in the area, but they can and will still benefit from pain relief. So again, that would be my recommendation. Clean your skin properly, and then slowly ramp or stay under 50% for the first 5 to 7 minutes, and then slowly ramp above that threshold after that. So we have a question here from Mr. Lowell Smith. Mr. Smith, thank you for joining. His question is, could you discuss approaches to manage phantom limb pain? Yes, that's an excellent question. Dr. Smith, I don't know if that's completely applicable to the foot and ankle wrap, to be honest, but we do have a lot of experience treating foot and ankle pain, or I'm sorry, treating phantom limb pain, I should say. The difficulty there really lies in electrode placement, to be honest, because we're trying to treat an area of the body that is no longer physically present, right? So the idea is to encapsulate the nerve endings that are remaining from the amputation in treatment. And with foot ankle wrap, that could be very difficult, right? Or if you have a patient that's has an amputation above or below the knee, could also be very difficult. They're still feeling pain in the foot area. So my recommendation for that question would actually be to use the electrodes when doing so, right? And you're going to have to experiment a little bit with electrode placement. Typically, if you're dealing with a patient that has, say, a lower leg amputation, either above or below the knee, you're going to want to experiment with placement on the stump with electrodes there to see where you're going to get the best results. So typically, electrodes are going to be placed over intact skin at the bottom of the stump to try to capture that pain treatment area. My recommendation would be to initially start with a certain placement with electrodes on the end of the stump, at least an inch apart, so they're not going to touch any time during treatment. Have the patient ramp up the treatment to a level that's strong but comfortable initially. After the first, say, 7 minutes or so, the patient should know if they're experiencing a perceived numbness in the pain location. Okay, if they don't feel like the treatment is beneficial at all at that point. If they're still feeling pain in the perceived limb or the limb that's no longer present, at that point, I'd probably stop treatment and reposition the electrodes to a different location on the stump. It could be a difficult thing to encapsulate, you know. You're going to have to experiment a little bit with placement on the stump, and the electrodes would be your better option. You know, to talk on that, our goal is to come up with in the very near future here. We do want to develop a stump sleeve for both the upper extremity and the lower extremity, to address this concern directly, because we do work with a lot of amputee patients who experience phantom limb pain. So that is on our development moving forward here in the near future. We do hope to have that available in 2025, but at this point, your best option is going to be electrodes, and I'd be happy to discuss further with you offline if you need. Okay. Let's see, other questions we have here. Is there a risk of damaging the electrode pad if it extends through the D-ring when tightening, or is the size designed to prevent that issue? It's a great question. So the sizing is designed to prevent that issue. Okay. If you have a patient that has a foot ankle wrap and they're finding it necessary to tighten it enough so that the electrode starts to come through the D-ring, then your sizing is off, honestly. And I would say they need a smaller size at that point. You know, you don't want that electrode to start to come through the D-ring. It could be uncomfortable. It could also cause issues with stimulation. You're going to have if it starts to come through that D-ring, you're going to have a little gap between the electrode and the skin, which is not going to be beneficial to the patient. So at that point, I would say your foot ankle wrap is too big and they should size down. And that's something we can help you with in exchange for here too, internally, or help the patient directly. Third question, are there any specific contraindications or precautions that clinicians should be aware of when recommending the foot and ankle wrap? Honestly, no, not outside of the ones that Brad mentioned at the end of that slide. As long as the skin is fully intact and there are no other contraindications for the patient present from our normal contraindications, you know, that Brad had discussed there. So no cardiac pacemaker, skin fully intact, no issues, patients not prone to seizures. Those are going to be our really big ones there. As long as that is not the case, there is no concern there. And I think with PDN in particular, no, the skin could be flaky, sensitive, thin, right? So that's all fine. There's no issue there as long as it's fully intact. And then let's see here. I think we have a fourth question. How should patients care for and maintain the BioWrap to ensure longevity and effectiveness? I think Brad had hit on that a little bit here too. Main thing is to keep the device or keep the garment clean, you know, so you don't have to clean it after every use. Depending on usage, I would say every 1 to 2 weeks. You want to make sure, number one, that patients are applying the conductive cream directly to the skin, not to the electrode silver fabric, right? You'll get better efficacy, better conduction, better results. You want to apply directly to the skin. Applying directly to the electrode or the silver fabric can kind of gunk it up, make it harder to clean, and also reduce your conduction and intensity. So that's first and foremost, is apply the cream directly to the skin. Second is to use the proper amount of cream. You know, it's kind of a fine line there, right? But you want, like I said, about a pea size amount for each silver fabric electrode. Rub it into the skin throughout the treatment area. You know, there shouldn't be a lot of white film after. You know, most of it should rub directly into the skin. And then afterwards, like I said, you can clean it with a Purell wrap, as Brad mentioned, or a Purell wipe, I should say, as Brad mentioned. And for more thorough cleaning, once every couple of weeks, you can, you know, hand wash it with a little bit of mild soap and warm water, just to make sure to disconnect your snap connectors prior. You don't want to get any water in those metal snap connectors. And then it does look like we have one more question here. What are the key differences between the foot and ankle BioWrap and other similar products on the market? That's a great question, but to be honest, I don't know of many competitive products on the market for the foot ankle. I am more than willing to discuss them in specificity, but I've never come across any. To my knowledge, I don't believe any of our competitors have any garments specifically for the foot ankle wrap. I know some of them have back vests and lower lumbar wraps and things of that nature. I know there's some vibration heat gloves available out there for the hand wrist. I've never seen something, a conductive garment made specifically for the foot ankle, but I'm open to discussing it if somebody has any examples more specifically. Okay, well, everyone, I again, I don't have any other questions. I don't see any others in the question and answer queue here. So I just want to say I really appreciate everybody attending today. We are very proud of our garments and what we do here at BioWave and our ability to help veterans and help providers help their patients in general. So it's an honor for us to do so, particularly in the government space with our well-deserved veterans here. So thank you for attending. Yeah, if you would like to reach out to me directly, please do so. I can send an email out to everyone after this with my direct communication, my direct email, and direct line here. So that would be the best. I don't believe I can drop it in the chat here, unfortunately, for everybody to see, but we can send out an email after. My name is Tony Quiroga. I am the Senior Director of VA Sales here at BioWave. You can call our general line and ask for me directly if you don't get that email. And you can also reach out to support at BioWave or info@biowave.com with any sort of general questions. I will make sure those get to me and I'll respond to them directly. So thank you very much for your time and for considering BioWave for your patients.